Can you travel with Lyme disease? I'm Dr. Daniel Cameron. This is part of a Common Sense Lyme series where I discuss issues that come up in my practice. So let's begin. With the right mindset and preparation, I have patients who can travel while honoring their limitations. This guide offers tips if you travel while you have to manage fatigue, POTS, food restrictions, flare ups, Herxheimer reactions, the works. Hydration tips are important. You should carry water at all times. Start with a full glass of water. Use electrolytes. I would avoid a lot of the sugar, a lot of the sweets that are out there that are available at airports and other places. Now, you have to manage sleeps and flare ups because in unfamiliar settings, sleep can already be a problem anyway. It might not go so well, but try to find a way to at least get to the room, get some exercise in, or even if it's just a walk or movement, and also try not to overschedule when you have to get up in the morning. This is a particular problem with weddings where there's long hours, plus you have to get ready the next morning, and it's hard to get the sleep that you need. Also, a nap might help, or walk might help. I like to pace or gently move during the day. It's really easy to be sitting in one place. It's important to stretch, even if you can't really get out of bed or out of the couch. Just listen to your body and rest. But more important is that movement is needed to keep some control over the symptoms. When you have food sensitivities, MCAS, alpha gal, SIBO, you should try to plan what you're going to take, what you're going to eat, because as you're traveling, it's very hard. There's a lot of temptations, a lot of suggestions of what to take. So that's important. You might have to plan a kitchenette, bring snacks, and also avoid alcohol when you travel. Of course, you should avoid alcohol anytime, but particularly the invitation when you're traveling to have a drink. Even simpler things like sugary drinks might be a problem. So be careful. You might want to have sparkling water or fruit infused drinks and manage your medications safely. You might have to carry on the medicines, TSA approved coolers, bring medicine list, all the details you need. Also, it's better to plan ahead to make sure you have enough medicines when you go. There's a lot of pharmacies that can honor prescriptions in the United States, even if you're at a distance, but you still want to plan ahead. Also, with the time zone difference, it's important to set alarms. Should build in flexibility instead of having a rigid trip where you have to do everything uh, that has been scheduled. For example, if you have a wedding, you might have to skip something or go for a walk. You might have to do something else to get away from the noise and the other issues that are there. You might have to plan rest days some days. Just try to build flexibility into your schedule. And if you have problems, and many people that I take care of have troubles, be flexible, try to cancel things, slow down things. But I often tell people if you're suffering anyway, and you need to go, is that you might still suffer some there, but still you have a life to live. So I'd encourage you for the journey to, you should change plans, rest if you need to. And you're going to have hard days at times at home, but you might have a hard day when you're walking. Can you travel with Lyme disease? Yes, it's not easy. There's sometimes no way to avoid traveling. These are tips that I discuss, but please write below in your comments problems you've had, tricks you've come up with, and sometimes you might even want to include some disasters. But if you can travel, these are important discussion topics. So thank you for joining me for this Common Sense Lyme series.